Hello everyone, this is Christy Villanueva with the West San Antonio Chamber of Commerce, and this is our special series related to the coronavirus pandemic. The West San Antonio Chamber caters to a lot of small and medium-sized businesses, folks that are under 200 employees, and tell us what we really need to be maybe looking out for as business owners, as employers, maybe just managers, and how to deal with things in this uncertain time.
Okay. Well, I'm very happy to be here talking to you, but not happy that this topic is something that we have to discuss. I'm sure this is a very scary time for people with small businesses, as it is for everybody, employees, healthcare providers. And it can seem as though many of the measures that are being taken to close businesses that encourage people to gather, that can seem extreme and potentially unnecessary, but I would like to let you know that it is very necessary. There would not be these sort of closings if there were any chance it were safe to leave businesses open. Absolutely. So every business that complies with the requests to close, to have their employees work from home, is actually contributing to what we need to slow down this virus until we can get a good treatment, until we can get a vaccine.
Related to the businesses, I know we've heard, so Mayor Nuremberg and Judge Wolf and their groups have said, all right, so we're going to close cafes, dining room facilities, any athletic events, any concerts, entertainment related, and that's a very positive thing for San Antonio. Some folks criticized that and said it was too early when they issued that order. I personally felt that it was good timing, especially in the midst of spring break. People could have already had the virus and been in close contact like that, and they would be asymptomatic. I think a lot of folks don't understand that.
Yes, correct. In fact, yesterday it was confirmed that in San Antonio there are 6 confirmed cases of people with the virus who have not traveled nor had contact with somebody who traveled or who had the virus, which the term for this is now community spread.
Okay.
When it has spread, you have 2 unrelated people who got the virus separately, you can safely assume that about 1% of your population has it, just statistically.
Right.
So that means we've all been trying to avoid people who are sick. We've all been trying to stay home when we feel sick, but that means some people who did not know they were sick or did not feel sick or felt they had allergies or a cold spread the virus to people who spread the virus to people who spread the virus. In cities and in different parts of the world where they've had enough testing to test everybody, the group of people who were most likely to test positive were people between the ages of 20 and 30. And of all the positive tests, 40% of people had no symptoms. Most younger people have a mild flu, cold that lasts a little longer than they expect. But because they don't feel so ill, they naturally do not stay home. And it is the younger people in our society that interact with the most people.
Yes.
And so I would urge, even if you're running a business that all your employees are 17 to 20, that even though they are not at high risk of being damaged by the virus, that their parents, their grandparents, and the friend they have that has a kidney transplant and is taking medication, those people can be severely harmed by it. So even sending keeping the kids home from school, sending the teenage and young adult employees home to work from home if possible, that helps to reduce the amount of virus we have in the city, and it can actually decrease the death from the virus.
So it's interesting when you mention those with compromised immune systems. Like I have a compromised immune system and most people would never know.
Correct.
These younger people between 20 and 30 years old, they are our spring breakers. They are the ones, the minute we called off school, the majority of them, from what we're hearing, no specific numbers, they hit the road. They are out, they are on the beach, they are traveling, they're driving around. And if they didn't have it before, they could have it. And now we're calling them back home. Now we've shut down the beaches and the different places. So I think we've heard that it's very confusing for some of our business owners because their children that are in college are now coming home. I asked for your recommendation in those cases.
So yes, unfortunately, this virus is coming in San Antonio when we have a lot of allergies, and the symptoms of the virus can look very similar to allergies. The virus can have the fever, but it may not. So I would recommend, if you have employees who are coughing or sneezing, that those employees leave work and contact their primary care doctor by the phone. Okay. The patients of mine that are contacting me, if they normally have allergies at this time, I can ask a lot of questions and try to figure out the likelihood that it's allergies. If it's likely to be allergies, we intensively treat those allergies to reduce the symptoms so that they can get back to work sooner.
Okay.
I have no way currently to test somebody to see if they're free of coronavirus. And even if they're free today, doesn't mean they're free 2 days from now.
Right.
And if you have allergies plus coronavirus, you are a big spread of the virus, because that's how it spreads, coughs and sneezes. If somebody must be out amongst people and they are coughing and sneezing for any reason, I recommend that they cover their face.
Yes.
We don't have enough medical surgical masks or the respirators for the people who are in the hospital, the doctors and the nurses, taking care of sick people to keep themselves well. So I don't recommend people use those, but if you are coughing and sneezing and you leave the house, the CDC has recommendations for using bandanas and scarves and homemade masks and cloth masks that you can take home and wash and reuse that can protect the people around you. A mask is not protective of you getting the virus, not the type that we use in our everyday life.
Yes.
But it is very helpful in reducing the spread.
Okay.
If you must leave your home.
Okay.
If someone is coughing or sneezing or not feeling well, the very best thing is to stay home and to avoid contact with people until you're well.
That makes very clear sense. And I know still in our city, there's construction still going on. As a matter of fact, behind our office, there's a huge construction site. We can see all the buzz going around. We have folks at H-E-B's and Walmart. So we're advising folks to stay home, call their health care provider almost as if it's a telemedicine function. And they can call. Now, if they don't have insurance, I mean, there is a way to just continue a self-pay process.
Yes.
Okay.
So my office for my established patients, you don't see very many people coming in right now.
Right.
Normally this room is full. One of our physicians is at home taking calls.
Okay.
That reduces the number of people in the office. I am here taking phone calls in my office for the majority of the day. We've converted all of our regular appointments over to phone consultations. And then after I speak with someone, if I feel that they need to be seen and it's safe for my staff for them to be seen and it's appropriate for them to come in, I'm asking them to come in.
Wonderful.
So, but we are doing these telephone consultations and we're doing our best to work with insurance to make sure that people don't get big bills. But there are also telemedicine companies. There is, if you look up telemedicine company, you can get consultations for cash. It's not usually very expensive, $40 or so.
Okay.
And you don't have to interact with other people where you might give it to them or you might get something new.
Yes.
And they can help you sort out what you are to do. It is the primary care doctors and the people on the front line. We are helping to keep people at home that should be at home, get people tested that should be tested. We're working with the health department, and to get people to urgent cares who need to be there and to emergency rooms who need to be there.
Okay.
If everybody rushes in person to an emergency room or an urgent care, there will be a difficulty in sorting out who is sick enough and needs care from who is worried and has a mild illness.
Yes.
And if you didn't have coronavirus before you sat in an urgent care for 2 hours, you probably do afterwards.
Oh my goodness.
So call. I am sure anybody who calls, we will do our best to help them. We have a system where we have a lot of people answering the phones. We have an infectious disease doctor on staff, and we are keeping up with the health department recommendations and the CDC recommendations daily.
Okay.
So being able to get people the information they need, I'm sure we'll do our best.
Yes.
If people are looking for specific information about coronavirus, there is a line that is staffed with people who have all of those guidelines at the health department,
Okay.
the San Antonio Metro Health Department, and we can give you the number and we can put it on the website. They are ready and waiting to answer those questions.
Okay.
And I called the other day and they answered the phone within a few minutes and
wonderful.
could answer all of my questions. So that is where I refer citizens to. If
Okay.
you don't have a primary doctor and you don't have access to telehealth, or you have general questions about, my aunt who was at my house for 3 minutes is coughing now. What do I need to do about that?
Yes.
Those are the kind of questions your primary doctor can answer, and if not, you can call the San Antonio Metro Health Department.
Okay.
But the CDC is actually cdc.org.
Very easy.
And you can find all of the most up-to-date information and recommendations that is updated daily on that website.
Any particular messages that you would give our business owners as we move forward, because there may be more information. It seems like this week we've had multiple press conferences from the federal government, from the city, from the county, and things keep moving in a particular direction that's not very positive right now, and it's changing daily.
Correct.
So what would you recommend our business owners to focus in on as we move forward in the coming days?
The information we've been getting over this 2-week period has shown us now a pattern, and that pattern has been shown to us in other countries. It is exponential growth of infections, and when you look at the numbers, even just in San Antonio, the numbers have been exponentially growing, which means it will continue, especially if we continue everything we're currently doing. So what we were doing last week, if we behave like we did last week, it will continue to exponentially grow. So the changes have been coming as we found that, and now we know that we are in that exponential growth phase. So as much as the employers can do to help people to isolate, the better we can slow down that exponential growth. So if the employers have the ability to have people not work or work at home, even if they seem well,
Yes.
if they must work in an enclosed space, that they stay at least that far away.
Yes.
That anybody who is feeling ill or is coughing or sneezing, that they be sent home and not require doctors to write notes, because that can cost their employees money to get that excuse.
Yes.
People should only return when they are well. And when people are not at work, I encourage them to stay home with their families and to decrease the interactions, the social interactions, even with small groups. My family has not had social interactions that is not over the web since we returned from our spring break trip to Oregon, which when we left, we didn't know there was a problem.
Yes.
So we go to work, we stay away from people at work, we come home, and we go to the grocery store a little, and that is all. And we are hoping that young, healthy people, when they get the virus, if they don't spread it, they clear it. And if a person gets the virus and gives it to no one else and they clear it, they killed it and stopped it there. It actually truly saves lives.
That's wonderful. I'm so glad that you're you've made that recommendation. Now, while we're staying home, there's also sort of that concern of the cabin fever, because we are so social in San Antonio and of course in other parts of the country, and we love to just hug and kiss, and we love all over each other. Do you think that that's going to have a mental health impact on, you know, the adults and the children alike, and especially if we have to self-quarantine even within our own home? Are there any recommendations for that?
There's some evidence that if you do things like having a schedule, a lot of us, especially kids, but even adults, do better with a schedule. So you schedule work time, you schedule eating times, you schedule play times. You think of this in as positive a way as you can. We normally spend a lot of time working and not concentrating on our families and our hobbies. If you want to learn a new language, now is the time. There are free courses from Ivy League universities to learn about topics you may like. Maybe you have some coloring pencils and some paints you haven't taken out in a long time. Instead of sitting waiting for when we can get back to normal life, let's take this break to do our duty and stay away from people and not spread the virus, while helping ourselves to slow down, heal, enjoy our families, nurture our relationships, so that when we all can come back together, we're better rested and more appreciative of what we do have.
Thank you so much, Dr. Brown, for your time, and we appreciate everything you and Gonzaba does for our community. It's very significant for all ages, for all people, you know, of different walks of life. And thank you for joining us again for these special episodes that we are hosting related to the COVID-19 and coronavirus pandemic. We are bringing you information so you can be informed as business owners. I am here at Gonzaba Medical Group with Dr. Brown. Don't forget to call a friend, call your children, your grandchildren, and make sure that they are doing the same so San Antonio and our surrounding areas can stop the spread of this virus immediately. Thank you for joining us, and we'll have more information and more episodes soon.